talk about the developing a patient-centered outcome goal. Right one. Are you guys seeing that, my screen that says patient-centered outcome goals? Yes. Okay.
Yeah.
Now if I can just get it to work. Technical difficulties today. Okay, here we go. So first of all, it helps to talk about self-management. So when we are working with people, and I think, all of us can think of this topic that I'm presenting today and think of ourselves and something that we're wanting to improve or change about ourselves. So it's self-management support for patients is just helping that person take charge of what it is that you're trying to help them accomplish in their life. Um, by doing that, we're sharing resources and helping with some tools for effective decision making to encourage them to set the goals and hopefully achieve them. So goal setting is crucial in self-management as it provides a clear direction for patients, enhancing motivation and focus. So I'm sure a lot of you have heard about having SMART goals. So things that are specific, measurable, achievable, relevant, and time-bound. Because so often we want to do something, we really do, but we don't get there. And a month later, like, wait, I was going to do that, but now I don't know what happened. So if we have set down some specifics and measurable things, etc., we have a lot better chance of actually getting there. So a good place to start when we are doing goals, especially with other people that we're meeting in our settings, is to begin with values. Like, what are your values? Values can be defined as the importance, worth, or usefulness of something, highlighting their central role in identity and motivation. So for many people, there are things such as, family or their health. And those are broad, but more specifics help. And as I'm mentioning this, if you want to think for a moment, like, what are your values? How do those values guide you in your choices for leading your day-to-day life? So values help healthcare providers align treatment plans with patient priorities, ensuring that care is meaningful. And awareness of patient values enhances satisfaction and fosters adherence to treatment as actions resonate with personal beliefs and aspirations. So I think oftentimes in my past, in dealing with people that are trying to help me with my goals, healthcare providers and such, that if we don't start at this place, like it's hard to really buy into it. So it makes a lot of sense to begin with values. And how do we do that? I mean, you can't just walk in with someone and say, what are your values? It really is important to have some sort of a rapport with people and have some questions that might help prompt reflection on what matters most. And so again, like things like family, health, or personal achievements, but be able and willing to have a dialogue and a question around that topic. And then as those you become aware of those, then you can move into trying to use those values into meaningful goal setting. So with the SMART goals, ensuring clarity and focus and enabling patients to pursue their objectives confidently and systematically. So, for me, I'm thinking about going on a trip in the fall, which is going to be a place that's really beautiful, and I want to hike a lot. So as I'm, looking 5 months from now, it's like, okay, I want to be able to hike a lot. So if I have someone to come alongside me and say, how are you going to do that? If you value this experience and what you want to see, then how would you, set up goals today, and then check yourself or have a partner to check with you on how you're achieving that. Some of our patients and people in the communities that we're encountering have such challenging situations that a little help, a little listening, or a lot of listening, and then kind of helping them define what matters most to them. It might not be what we think should be what matters most to them. So sometimes, we're like, okay, you're really battling depression. And so medication adherence is, we want to just say it's really going to help and then we can do these other things. But that's just not the recommendation here. It's that, it might be that situation where you want to draw from them. Well, family time is what really matters most. So we tailor what's crucial and we listen and we go with what they say is most important and how they want to form those goals. So in this situation, a patient prioritizing family might set a goal such as attending dinner with their daughter twice a month. That's specific and measurable, and somewhat time bound, but also aligns with their core values. And I'm sure you can imagine if they did have underlying depression, that you could see how this could build into strengthening them to be able to think about being consistent, and having good med adherence. So it should we should always make sure that when we're doing that it has clear direction and clear intent. And then time bound could be even more specific than twice a month. We could add for the next 3 months. And then we can say, if it's okay, can I check in with you on this next month? And then just evaluating with them. So we should always consider an individual's current situation, resources, and capabilities. I know I'm speaking to people who know firsthand experience much better than I do. I know I've watched you all work and appreciate and respect the work that you're doing, but this is just kind of a review to provide a framework for what our next topic is going to be today. And that's using the patient activation measure. And I don't want to try to define it because Laura Wilbrecht is here to define that for us. And she is a consultant on the client services team at Frisia with over 20 years of experience in healthcare. Laura is an RN who has previously provided direct patient care in Portland. In her current role in Frisia, she helps providers, payers, government programs, and science organizations administer the PAM tool. So Laura, if you're ready, I will stop sharing and we'll let you go ahead. And I thank
Okay.
you for being here today.
Oh, thank you for having me here. So let me um, make sure I'm going to do this right. So 1 second.
I've demonstrated for you all the pitfalls, already. So
Yeah. So I see you work in healthcare. Technology is not always my strong suit then that way. But um, I'm just trying to have it present in Teams. So let's see if it'll work. Oh, there it is.
I
All
can see
right.
your screen. Yep.
Perfect. Okay, so I'm here today. Thanks for having me again. Just to give a kind of a high level overview of the patient activation measure. Just to let you know real quick about Frisia. We've been around for about 20 years and started out as an intake solution where we partnered with provider organizations to offer digital intake. So taking that clipboard where patients would, write out and complete those demographic forms and doing it digitally where it would be sent to them, where they could complete it on, their phone or on a tablet prior to their check-in. So Frege has grown since quite a bit since then. And a few years ago, they acquired Insignia Health and the patient activation measure. So I was part of Insignia as I have been working with Pam for about a decade now. So the patient activation measure, I'm not sure, I know some of you are familiar with it, but if not, it is a 13-item survey and it measures a individual's knowledge, skills, and confidence to manage their own healthcare. It was developed about 20 years ago by Dr. Judith Hibbard while she was at the University of Oregon. And it's been used in use since through research and commercial use. It's backed. Now I think we're almost about 850 or so peer-reviewed published studies worldwide that have all documented PAM's ability to measure activation and really predict a broad range of health-related behaviors and outcomes. So this foundation and all this research consistently has demonstrated that individual self-management improves significantly as activation increases, which even that alone has led to us being a consensus-based entity endorsed performance measure. But what's really important about PAM is what you can see in that box on the lower right-hand corner. What we know from all of our studies and working with clients is that PAM reliably predicts a number of really important clinical outcomes, such as medication adherence, preventative health behaviors, such as patients having colonoscopies, mammograms, vaccinations. Also, if somebody's at risk for those unwarranted ED visits or hospitalizations and readmissions. And also an individual satisfaction with their care. So it really can give a full picture outside of just clinical and claims data. So as I mentioned again, we work with a lot of payers through Medicare, Medicaid, commercial plans, where they really use PAM to identify risks or allocate their resources to help tailor support. We work with CMS programs. One of them is the CMMI Kidney Care Choice program and MIPS. State programs such as Washington Health Homes, other state government programs, and also provider organizations, including FQHCs and life sciences. And we are global in lots of different health systems globally and organizations as well. So there's a strong body of evidence that really validates that association between the PAM score and patient behaviors, outcomes, and cost of care. And we really can see this across all types of conditions. So it's not condition specific. So, I mean, we've seen it in diabetes, heart disease, behavioral health. And what we know is when a patient's activation increases, we see those improvements in self-managing behaviors that Laurel, you talked about a lot, such as seeking preventative care, lifestyle changes, again, adherence to medication regimens. And these changes can help lead to better clinical outcomes, such as controlling your blood pressure, blood sugars, again, preventing that unwarranted use of health care services. And patients really then take a more active role in their health care and their recovery. And this all can lead to those reduced total healthcare costs and patients really being more satisfied with their care. So here's a little quick snapshot. If you haven't seen the survey before, the 13 items is the one you guys are using. Again, it's really that gold standard on measuring activation and a person's self-management ability. And by doing this, assessing their knowledge, skills, and confidence. It really only takes a few minutes to complete. And we have over 30 languages available. And we also have, besides the patient PAM, we also have a caregiver and a parent version. So after a patient completes the PAM, you're going to receive two metrics, a PAM score, which is between 1 and 100, and it corresponds to a PAM level between 1 and 4. So the most important thing to really know about that score is it's modifiable. It can be changed, and based on research and clients that we work with, even a single point change is really significant and clinically meaningful. So um, the level really has predictive power, and it really can help identify those at risk, those who need more support, what we would call higher risk. And it also can help you effectively counsel or coach your patients about their health behaviors. So it can help you with setting appropriate goals by their level, how to talk to them, what you talk to them about, the frequency you might talk to them. Um, and so that's how the PAM level helps. So here's a brief overview on each of those PAM levels and the personas that we see. If you were to start using PAM, we do have trainings and resources available for a deeper dive. But here's just kind of that quick snapshot. So again, the most important thing to know about that level, how effectively to work with your patients, and the lower levels are 1 and 2, so the least activated. Levels 3 and 4 are the higher activated. So for those individuals who are lower activated, these are those individuals you can really, they're really more passive recipients of their care. They're individuals that, really get overwhelmed when they think about their health or they think about the things they need to be doing regarding their health. When they think about, say, having to go pick up a prescription, that might be overwhelming for them. I mean, they might easily forget, get discouraged. They might try to take a step, but then if they try to make a change, and they weren't successful, they might get easily discouraged, and therefore they can easily disengage, from their care. Now, on the flip side, there's the higher active innovative individuals. So these are the individuals we think of as being really proactive in self-management, managing their health. They usually have a larger knowledge base about their health and their chronic diseases, what they need to do to be managing these diseases. They usually are the ones that keep up on follow-up visits, preventative care, picking up their medication and refills. If they have any issues, they know who to turn to. If they, encounter any barriers, they're more willing to reach out. And the higher activated individuals are also much more resilient in times of stress and change as well. So if we look at those, even in like a primary care kind of situation, just some basic things too, lower activated individuals might, not show up for appointments or follow those recommendations. Some of them might have frequent calls to your office, or maybe they don't, even call at all. So they can just get really overwhelmed, or frustrated during visits. But on the other side, those higher activated, they're the ones that are usually going to show up for appointments, have those, follow-up recommendations that you provide, and they won't require, as intensive of support, and usually are much more satisfied in their care. And so again, just if we look at preventative health, with primary care, it really can help kind of close those gaps with vaccinations, preventative screenings, or annual exams. You can see how that increase, if you're like a level 4 who's more activated, you have a much larger percentage of those individuals are going to be the ones that engage in those preventative measures. So now just kind of a quick overview of, how do you administer PAM? So it really can be administered with multiple modalities, whatever would end up working best for your workflow. It can be administered in person, whether it's verbal, whether it's you hand the patient a piece of paper to complete it on their own, over the phone, via email, during appointment, or if, while they were waiting for an appointment, and office staff could hand it to them, as long as, there's that proper introduction and using best practices, and the individuals or how you're administering it is, consistent with doing so. We have a system that is available for all clients to be able to enter in the PM surveys and get their scores and levels. We also do integrations with organizations as well. So you can, enter those responses into your system and it automatically gets scored. So there's lots of ways that we can work with clients on, what works best for them to be able to do that. But once you do have that score and level, that's where your staff can really begin to tailor the interactions with the patients individually. So, those are with the lower activated, again, you might focus more of your resources on those patients. With goals, it's going to be smaller goals, tailored interactions. Maybe it's more of those individuals you refer to other types of staff, whether you would be if you had pharmacists you work with, social workers, community health workers, those lower activated individuals, you might then refer there for more support. So now that you have the score and level, this is where we kind of use those strategies to help supporting increasing patient activation. Again, tailoring that care and coaching by their level, communicating with your patient, the ownership and partnership of how they really need to have that active role when you're working with them. And also, I think, Laurel, you talked about this too, finding out what's really meaningful to that patient so you can help activate them and help them meet those goals. And sometimes you're going to do that by breaking up those goals into small steps and then, celebrating success to help build confidence, which is part of activation. So we're going to be building the knowledge, the skills, and the confidence to move them along. So when we look at goal setting based on the activation individual, with level ones, the goals really are going to be about building basic knowledge, promoting self-awareness, and really helping them start to grow confidence through this goal setting and small successes. So the goals might be quite small in and of themselves, or maybe not clinically meaningful. I think that was mentioned earlier. But it really can be meaningful for the patient and then therefore feel like a win, and in turn can help increase their motivation to take those further steps. With the level two, when you work on goals, these individuals are becoming aware but still struggling. So you're still going to be goal setting to help increase their knowledge, their basic skills development, and connecting those behaviors with outcomes. So really working with them on what motivates them to improve their health and why, it's important. With the level threes, now we're getting into those individuals who are more higher activated. So they're usually taking action and gaining control. So we're going to, you want to set goals to help close those knowledge gaps, initiate, new behaviors, and help them strive for those kind of best practices and recommended behaviors. So this is where they might start even be thinking about some long-term health goals, but still probably breaking them up into, either smaller achievable goals to meet them or, action steps. With the level four, most of the goals are going to be revolved around maintaining those behaviors and even pushing them further, or how to help them with goals on troubleshooting during difficult times, if they had a new diagnosis or, a personal, setback, such, a loss of a job or a family member or such. And also then goals on strengthening, a lot of lifestyle behaviors, usually even more complex with, diet, exercise, stress management. And so again, with them, you'll still be working on more of those long-term goals and maintaining those goals long-term. So we did have a quick little case study on a FQHC that we've partnered with, HealthLink. They serve a really diverse population, and so it's very important for them too to address patient social determinants of health. It's really a core component of their mission, and so they partnered closely with us to help meet this objective. They have more than 40,000 patients annually that they work with. And so they really needed a better way to really help allocate, time with their limited staff. So they integrated PAM into their workflow. And then these patients who completed PAM at intake, the ones that had lower scores were referred to community health workers for more support. So it really helped them determine where their patients were in their healthcare journey and then the level of intervention they needed. So, and then also then, really helped with that, again, resource allocation with their staff and time, because, as we all know, healthcare is really, the bandwidth and the availability of staff is really limited. So Pam can also, really help with that. Who do we focus on, within our population when we don't necessarily always have enough staff or time to meet with every patient equally? So again, just kind of in summary with the benefits of using PAM, because it can really help both clinically with clinical and operational benefits to patients and organizations. So on the clinical side, it can really help better understand, your patient's needs and really help personalize care accordingly, which can then help with better engagement and then of course improvement of their activation levels and self-management ability, and then the clinical outcomes over time. And again, it's also really a powerful perspective risk identification tool, especially if you even get new patients, new clients, people you work with that you don't really know a lot about them. It can really help you identify those. If they're one or two, that they're, higher risk and eventually will have more long-term, health conditions and such. So you can start intervening right away. And the higher activated patients, since they're more engaged in their care, they really have, report higher patient satisfaction and rate their care expenses more positively. So PAM can really help guide those efforts as well, if that's a priority for your organization. And then operationally, patients, can also help you improve your patient flow. Again, lower activated patients might be more likely to no-show or be late for appointments, maybe not engage in those preventative measures, or, if you need to refer them to specialists, they might not show either. So you would help guide them more with that. And Pam can help proactively plan for that, and target them with more frequent tailored reminders. And again, knowing your patient's PAM levels, it can also really help with identifying and addressing critical gaps in care, to increase that volume of preventative screenings, wellness visits, can help segment your population more effectively to target your patient engagement strategies, saving your staff time and resources. So thank you.
Laura, that's such a great overview. I really appreciate that. And I can see like there's clinics that I'm working with that are on, and then mobile integrated health are there, and it's so pertinent for both. So I know with clinics, as we've worked through the primary care model that we are using for improving those. This is like the patient supports that we've all had trouble, like, oh, how are we going to do this? That question often we just have left unanswered about, well, how is your clinic assessed the capability and plan for the support of patient self-management? And so there's so much other thing that we're addressing that we've not always been able to get to that. But it's so neat to see the value of, okay, here's all these other things that'll work well in the clinic setting by kind of spending time on really, especially if we do some sort of risk stratification to say, okay, here's our patients highest at risk. We're going to spend more time, and just the value of that time spent and having a tool to help us, especially when we're so busy, to like go, okay, well, that coaching, those tools that you give for coaching for activation according to what level they're at, oh, invaluable. So, and I know, we have a couple of those guests that are going to share with us about how they're using it and their roles and their settings. And so it's going to be fun to hear from them on how that's been going and how they're utilizing it in their settings. And so I want to introduce Jason Pfeiffer, who graciously agreed to talk about how he's using the PAM at Community Health of Central Washington. He's a home health supervisor at CHCW and hasn't been a part of these convenings before, so is really, came into this cold. And I just want to say thank you, Jason. And if you feel comfortable to share, please share what you can on how you're using the patient activation measure.
Certainly. Thanks for having me. The first thing I just need to clarify is that we are health home, not home health. Very common misconception. Home health does nursing and stuff like that. Health home is a Washington State Medicaid program where we work with individuals who are struggling with maintaining their own health. It's more of a social work approach to helping people better understand, maintain, and then hopefully lower healthcare costs. But we use the PAM very religiously. It is a huge part of what we do. For clients or patients, I use the words interchangeably, so I apologize in advance. But for clients to become eligible and be referred to us, and I think I froze in a really weird face, and my camera is no longer working. So I'm just going to talk. This is the second time the camera's turned off. But essentially, in order for them to be referred to us by the state, they need to obviously be on Medicaid. They need to have at least one chronic condition. They have to have a PRISM score over a certain metric. And then ultimately, what we are doing is helping them build goals. We do a little bit of hand holding as well and coaching in order to get them to better understand and maintain their own health care. Most of the clients we are going to see are coming in at level 1 or level 2. They always get a PAM every 4 months, once they're initially entered into the program, and then every 4 months as we develop what we call the HAP or Health Action Plan. Essentially, the Health Action Plan is goals that are, what's the word I'm looking for here? Developed by the client themselves or the patient themselves, and then helped facilitated by us in Health Home. So with each of these goals, there has to be a long term and a short term. And I really appreciated that first or the presentation that was just on before me, because that helped like break down a lot of this stuff. But a lot of it is not just what they can do, but what is our role in this as well. We don't want to do everything for them, but we understand that without our assistance, they're not going to be able to be successful. And the PAM really lays that out for us when we're coming up with these health action plans and goals. Like I said, initially, most of the people we're seeing are level 1, level 2, which is disengaged and overwhelmed, or starting to become aware, but are still struggling. These are individuals with high ED utilization. They miss a lot of appointments. They're just struggling generally figuring everything out. So we use the PAM really in two distinct ways when we're working with our patients. The first is just to understand where they're at on that level of 1 to 4. Ultimately, our goal is to get them to level 4 and they don't need us anymore and they're off doing things on their own. Uh, but a lot of that initial orientation, and especially even every 4 months, just checking back in with them to see how things have been going and what's going right, where they need more help, uh, is a huge advantage for us in just being able to give them the PAM, look at what their score is, and easily identify, this person has no idea what's going on. They just need all the help. We'll throw everything at them, including the kitchen sink. And then over time, you see that they're actually starting to take action. We try to encourage them to download things like My Chart so that they can be a better participant. But the other side of the PAM are the individual questions. You have those 13 questions, which will tell you quite a bit about what they're struggling with and where they are currently in managing their own healthcare. Oftentimes, when they're level one, they're completely overwhelmed. I would like to manage my health better, but I have no idea how to do it. So when they fill out that 13 question PAM, I'm actually cheated. I pulled up the questions over here on my other screen. At the end of the day, I am the person who is responsible for taking care of my health. Well, if they say strongly disagree, and you're working on goals for them, why do they disagree with that? Is it because they don't feel the doctors listen to them? Is it because they're afraid to talk to the doctors? Is there another person involved? Because what we're talking about the PAM, I will also throw out there that there is the CAM, which is the caregiver activation measures, and the PPAM for the parents. So sometimes it's not even the client patient themselves, it's the people who are working around them so that you have to help them. And I think the 13 questions really, really helps identify where those areas of need are. Um, I know what each of my prescribed medications do. Pretty simple question, but if they don't know how to do that, I mean, a simple goal to come up with would be better understanding and consistently taking medications. Uh, Again, we're not there to handhold them, but depending on how much help they need, we can assist like in a lot of things, even like people who just can't seem to make it to an appointment. One of your goals might be attending all of my appointments for my hip replacement surgery. And then the care coordinators and myself will work to make sure they are aware of when their appointments are. Do they need assistance in getting transportation there? And how can we assist with that? So the PAM is a big part of what we do. We do it every 4 months. It's how we do all of our goal setting. It's also a good way to better understand where the clients and patients are coming from and their understanding of the healthcare system that they're currently involved in. I just talked a lot.
Jason, thank you so much. I think that's perfect. I myself have had a hard time understanding how to integrate this into the clinic setting. And with health homes, it makes sense what you're doing. And I think as I think about some of the clinics that we've been working together, it makes sense that it would be more of like if they're engaging with a community health worker, that because they've been identified as, of having like I could, in the language of the PAM, of a low activation score, but also the highest risk patients. So it really helps to hear how it's being used at CHCW. And then many of the things you said really spoke to me in regards to, okay, that makes sense, of how we can spend the time and the effort on utilizing this valuable tool. So I appreciate you coming. Thank you so much.
No problem. Can I
And
add one more note before I
yes,
mute myself? I would say on the other end of the spectrum, it's very helpful in figuring out where the clients are, but it's also very good at finding out mentally where the clients think they are.
mhm,
Oftentimes they will fill out that they are perfect. They have a 4 score, but then you look at their actual medical records and you realize that's not the truth. So where is the disconnect and how can we better resolve this so that they understand where the shortcomings are?
wonderful. Thank you so much. I
No problem.
appreciate that. Okay, so we've heard from clinics and we have mobile integrated healthcare to think about kind of specifically. And so Danielle, how do you say your last name?
Birchie.
Birchie.
Think like
I
birch
never say
tree,
your
but
last
it's
name.
birchy. I know.
Yeah, and so just Danielle. But Danielle is a community health programs manager for Kittitas Fire 6 and a community EMT CHW. Basically, if you need help, she's probably already on her way. I totally believe that. Along with her partner, Corey Reagan, they average 40 patient contacts a week on top of responding to 911 calls. I have some other really neat things to say about Danielle. You guys, probably most of you know her, but I want to take away from the neat stuff that she's prepared for us. So Danielle, go right ahead.
Okay, can you guys see my screen okay? Okay, I'm not used to using Teams, so fingers crossed that everything works okay. And also my camera was going in and out, so I had to like bounce out, come back in. And then when I first joined, I was Chief Troy Jackson, according to Teams. So I'm Danielle. I'm from Fire District 6 up in Kittitas County. We work with Upper Kittitas County Medic 1 as well. And we run the MIH program for Upper Kittitas County. So I'm going to go over kind of how we utilize the PAM assessment and some of our tips and tricks. And even if you don't work in fire EMS, you still may be able to use some of these tricks. So we're pretty excited to share these. So when you first log in, if you've never seen it before, this is what the dashboard looks like. If you look over on that left column, you see individuals, and you can search for individuals that are already in your system that you've already done an assessment on, or you can create a new individual. It's really easy to try to find people. We use this because we usually give the PAM assessment every 3 to 6 months. It kind of just depends per individual. Oh, I'm not gonna let you go. Stand by. Oh, I got stuck there for a second. Little trick, when you're adding a new patient, you have to have an individual identifier number on there. So on that left picture, you're going to see that red box. You have to come up with some sort of identifier. So if you're using, for example, point click care, you might just use that same one. That's what we do. And that kind of is a fail safe for us to make sure that we're not forgetting to enter in a patient. So that survey, we actually have a 10-question survey. Ours isn't 13. But what's kind of cool about that 10-question survey is that you can almost make it into just a regular conversation. It doesn't necessarily have to be a full interview process. Whenever we're doing our assessments, we have 7 of them that we do, with Pam being one of those 7. We always try to bring it into a regular conversation. We feel like people are more comfortable. We're sitting there in their house most likely. And some of these questions, you don't necessarily have to say word by word, do you follow your doctor's patient care plan from home? Can you follow that in high times of stress? So you can kind of add on to different questions. One thing that we noticed is that if your patient is answering, I strongly agree, to all of these questions, that's what your outlier is. It drove me crazy. It took me a couple months to figure it out, but realistically, there's something that everybody is working on that we are helping under our MIH program, because if they're answering, I strongly agree that when all is said and done, that I'm the person who's responsible for taking care of my health, for example, if they really are taking care of their health to the fullest capacity, then how come I received a referral? Right. So we're kind of paying attention to that. And then we can also ask, are you sure about that? Let's talk about this. Let's talk about that. And we can kind of give examples and talk through stuff too. So if you're getting an outlier on your dashboard, it's because somebody probably answered strongly agree on everything. We do utilize this PAM pretty strongly when we start to kind of get introduced to that patient. So for PAM, we usually ask that in our first interaction with the patient and our initial assessment, or maybe even the second or third one. We kind of feel it out, we feel the room. But when they are answering these questions, it also gives us some insight on 2 things, which I think were already mentioned. The first one is, how comfortable are they? For example, if they know what all of their prescribed medications are, chances are they're taking their medications because they understand just incredibly how important it is. But also we can kind of see what their challenges are too, and we can kind of focus our efforts and making sure that we are addressing those concerns and those challenges. So in reference to levels, for PAM, it kind of places patients in 1 to 3 levels. In my head, I always get these reversed. But basically for us from the fire side, what we're looking at is that high acuity versus mid acuity versus low acuity. So are they high utilizers of the 911 system? How often are they getting visits from MIH? And then how much guidance are they needing? You can call this hand holding, but for me, I'm just trying to help a neighbor be successful and be as happy and healthy as possible in their own homes. One thing that we are really focusing on this year is making sure that our efforts are matching what the patient's needs are. So for example, if we're over serving or under serving patients, we're not really helping them to their fullest to our fullest capability. So for example, if I'm visiting a patient every single day and they're already at a level 4, that's going to kind of clue me in, like, I'm seeing this patient too often, I should back off. They're doing a great job meeting these challenges head on. They don't need me to be at their house every single day. That's just an example that we're using. So for that patient profile, when you go to your dashboard and you click on a particular patient, you're going to see these 6 tabs at the top. And I just want to cover what these tabs are for. So the first one is that profile. So I can't show you any of my actual patient PAM assessments, but I can show you one that I made up by myself last year. So for example, this is just the profile. I can go in, and we actually asked Freesia to inactivate some of our patients, so I can actually edit the profile and say, hey, this patient has passed away, this patient has moved from our area, they're no longer enrolled in the program for one reason or another. And that kind of simplifies the data that I'm gonna have to weed through for different reasons. And then I can
Danielle,
also,
did you advance your slide? Because I'm still, oh, there we go.
Oh.
Okay,
you
got
got
it.
it? Okay,
Yeah.
thanks. Because I can only see, I'm not actually looking at what you guys are seeing. I'm just seeing what I have on my PowerPoint.
Okay, perfect.
Are
Gotcha.
we good? Okay.
Yep.
So one other thing that you can see is that if we are reassessing with the PAM assessment, if we are providing that again, you can actually see where they started, and you can see where they currently are at, and you can get the whole picture of their health. Are you helping them make improvements? Are you helping them with knowledge, with confidence? And that's kind of what our goal is, right? One thing to keep in mind is that they may have like they may step forward 3 steps and go 1 step back. They may take 2 steps forward and go 3 steps back because they were an inpatient at the hospital, for example. And that's okay. It's all right. No one's going to like smack your hand or anything, but it's something that we just want to be aware of. We can also see how many days since we gave the PAM assessment last, and that's really helpful. Again, this is just my profile that I made up last year for training. But it's kind of nice to see because our goal is to always do it between 3 and 6 months later. There we go. Can you guys see all the different tabs right here? Coaching for activation.
Yes.
Okay, good. So now I'm worried. Okay, so I'm apparently having a bad day. Oh, my partner's here. So I'm apparently having a bad day, and I've been diagnosed with CHF, asthma, high cholesterol, tobacco use, COPD, substance use, and depression. So this is coaching for activation. The CFA tab is one that we absolutely love using. What's kind of nice is that after your patient, I don't want to say labeled, but after your patient has been placed in a particular level, you are going to immediately get resources that work for that particular level. So for example, I clicked on CHF, and I am apparently a PAM level 2, and it's kind of nice because you have these subcategories towards the bottom. Let's say I'm new to CHF and I really want to know what CHF is. I just need my patient to know exactly what that is, what does it entail, what maybe caused it, what's going on with it. Let's say I am given medication, a diuretic or something else, and I can click on medication and I can get a whole list of resources. One thing that I want to point out is that where that red box is, where it says PAM level 2, let's say my patient is at a level 2, but I am not really finding what I need. I've already utilized everything. That's actually a drop-down box, and you can flip between levels 1, 3, and 4 as well. So you're not tied into just the resources that are available for that. So that's just something to think about. It took me a minute to figure out how to use this, but if you click on the tabs at the top, like wellness, CHF, diabetes, chronic kidney disease, etc., you can, those pluses and minuses, you're basically just adding that tag, that condition tag, that diagnosis tag to that patient. And then you have to actually click on a subcategory towards the bottom, that medication, stress and coping, smoking, etc. So you don't have to worry and stress about how to use that. I'm showing you how to use it. It's really easy. We use it all the time. So if I scroll down to the bottom of that screen, it'll actually identify some primary goals. So for example, on CHF, continue to build knowledge of CHF
Next
and how to,
slide. Got to see your next
Oh.
slide.
did it work?
No, I'm still seeing the picking and the PAM level 2 in the red box. Yeah. Oh, yep. Okay. We're there.
You got it?
Yep.
Okay, good. So under this particular one, we had 3 goals that were identified. Continue to build knowledge of CHF and how to manage it. That's just the one that I expanded. And then if you look on that center column where it says resources, these are all of the vetted resources that are available. And there's actually 3 different goals. I just expanded 1. And again, you can flip to, for example, level 3, level 4, level 1 under that topic, and you'll get even more. It's pretty exciting. If you want to track which ones you've discussed, they have in that right column, they have like check boxes that you can go through. I don't tend to use those check boxes. But what I do use these resources for is that every once in a while, it doesn't happen often, but every once in a while you meet a patient and you just are having a hard time kind of communicating. Maybe you need a topic of discussion and you want to bring up CHF, but you don't really know where to go, what to do. This is a great resource to look off of. Okay, can you see the heart?
Yep.
Okay, I'm going to flip forward 2 and then go back 1. Okay, so here's one of the resources that I just clicked on. It's just a random one. And this particular resource, it was actually a link that was provided. You click on the link and you have a video. And it's a really cool video. This is by somebody with like a British accent. It's pretty fun. One thing that I noticed, it does take about a minute for that resource to load, whether it's a document you can download, whether it's a link that you click on. But one thing that we've used this really successfully for is that some people, they're visual learners, or maybe there's somebody who, you need to talk to orally, and everybody has a different way of learning. So for example, if I'm trying to talk to somebody and explain what CHF is, but really they're a visual learner, how cool is it that I can just go to this video, or I can share this video with them? It's just making sure that they're absorbing the information in the best method that they can. Also, these resources are fully vetted. It's really nice because I'm not having to worry about, am I going to some weird website? Am I going to start sharing information that maybe isn't quite correct? And that's really what we depend on for this system. Can you guys see the PDF?
This is a congestive heart failure top things to know PDF.
Perfect. Okay.
Okay.
See, now I'm worried that you're not going to see what I'm seeing.
I got you.
So this is another example. So this is actually just a PDF document that you can download, but it's really cool because you can email it, you can print it, you can share it in another method. But some people, they like to see the diagrams. They like to see it. They don't necessarily want to hear you talk about it. They necessarily don't want to see a video. Maybe they want to read about it. That's kind of cool. I like it.
Mm-hmm.
Here's some other additional PDFs that we noticed. So goal setting and action planning worksheet. I feel like that's pretty universal for everybody. The form on the right, self-check plan. I just found this for the first time and I love it. I think this is really neat. On this next one, can you see reports?
Yep.
Perfect. So one thing that we just noticed is reports. So while we were trying to do our MIH quarterly reporting, I noticed that we may have forgotten a couple patients in the last couple months. Sometimes we get 1 new patient a week and sometimes we get 5. We kind of just don't know. And we needed to do some sort of report to make sure that we were actually adding all of our patients in. So I am going to show you something. So in this upper left corner, it says create report. You have level distribution, PAM responses, PAM individual data. It's really cool because it kind of gives you reports on different things that you want and you can customize each report. So it's like creating your own dashboard. So report options. This is one that we have been using to make sure that we are conducting PAM in a regular manner for every single patient. So all of the red boxes are kind of what we fill in. In that bottom right corner, you'll see download CSV. If you don't know, that's actually an Excel. And when you download that Excel, this is what it looks like. And basically, we just go in and we just file sort. Where you see the black boxes is actually where I didn't want you to see my patient names. But you just highlight the 3 different columns, and then you can actually just sort. And what we did is we went by a date and then by the patient's last name. I thought for a second, oh, I don't need the patient's first name, but then how many Johnsons do I have? How many Smiths do I have? We have a lot of couples as well, so we had to add our first name. But now I'm pulling this probably every single month, at least every quarter, so that way we can answer different questions. So if you are a part of the MIH cohort, FYI, you're going to have to know how many new PAM assessments you gave and how many follow-up ones you did. So that's just something I wanted everyone to know. Hey, it's not hard. If you have a large volume of PAM assessments, it would be a little bit tricky. You might want to think about pulling this report. We pulled it and we ended up missing 7 individuals in the last 4 months. So it's good to know that reports are out there. They're super dependable. They're easy to use. I like it. So yeah, we're using PAM on almost every single patient. It's pretty rare for us not to, but some examples where we wouldn't use PAM on a patient if we know that it's very short term. We know that there's no reason to even try tracking because this patient is going to be in our area for maybe 2 weeks, and we'll help in other fashions, but we're not going to track it via PAM. If we know that a patient's going on hospice, for example, we're not going to utilize PAM. They're not going to be with us too much longer. So I think we probably use it on about 85% of our patients total is what we're seeing. And we've had over 500 patient contacts just this year, and that's just January through March. So we're using it quite often. We actually have a packet of assessments that we have for every single patient, and we just tuck PAM right in there. So we're not having to find it. It's not something that's different. It's just one more assessment that we're using, but we're seeing that PAM is actually matching what we think we're seeing. So again, if I see a patient that needs a lot of assistance, they're very unsure, the knowledge isn't there, the confidence isn't there, I'm going to expect them to be at a higher level and then work our way down. Any questions?
Such valuable information, Danielle. I really appreciate the way that you presented the information. It's so understandable and usable. Unfortunately, we're super close to time. So I guess if you have particular questions, reach out to me and I will get you to Danielle for her, taking advantage of her experience. But we'll go ahead, and Anna Sandage from Greater Health Now is going to just wrap up for us with a few comments. Thank you, Danielle.
Yeah, thank you so much. We are just so excited at Greater Health Now to be able to offer this to our partners because we do see that it has just really high value across multiple settings. So if you aren't utilizing it, you don't know how to access that license, if you want to reach out to us and let us know through Laurel or me, we'd be happy to get you set up because it is such a valuable tool. It's evidence-based. And I love the example of using it through health homes because it's just such a powerful assessment tool that moves our patient and client population along. So if you don't know how to use it, let us know and we will get you connected.
Okay, thank you so much, Anna. And then those of you who need to sign off, go ahead. But Cody has a question for us. Go ahead.
Cody, you're on mic.
Hey, I had a question real quick.
Hi, Cody.
What do you think about using PAM as a screening tool with community partners? Like, for instance, if we taught our staff at our homeless shelter to do PAM, and then they did PAM, and they said, "Hey, can you guys come and see this person? They just scored a 1 or a 2." Then we go down and do it instead of us.
Yeah, that's a great idea. Danielle, do you want to respond to that too?
Yeah, so we are actually in talks of getting integrated as well with our cold weather shelter, which is only open for about 4 to 5 months a year. We don't know if we're going to be able to fully use it because we are not positive on what kind of paperwork do they have people fill out. Is somebody going to talk to them about it? Is it just another piece of paper for them to fill out? We're not sure if we're going to, but I think it's a great idea, and we've thought about that as well.
Great. Okay. Thank you guys for the questions. Thanks for tuning in and listening and participating. Presenters, you guys did a great job. We'll look forward to getting together next month, a third Thursday of the month. So take care and have a good day.
Hi, thanks.